Hello, everyone. I am presenting my Behaviorist biography on Dr. Carol Pilgrim. First, here are a few facts regarding her educational background and positions. Dr. Pilgrim earned her bachelor's in psychology from Virginia Polytechnic Institute and State University in 1978. She earned her master's in experimental analysis of behavior from the University of Florida in 1983. And lastly, she continued on to earn her PhD in experimental analysis of behavior from the University of Florida in 1987. Dr. Pilgrim has served as the chair of the publication board of the Association of Behavior Analysis International, commonly known as ABAI. She is also a professor of psychology at the University of North Carolina, Wilmington. She has served as an editor of the research journal titled The Behavior Analyst, along with being co-editor of the Experimental Analysis of Human Behavior Bulletin and associate editor of the Journal of the Experimental Analysis of Behavior. Here is a quick photo of Dr. Pilgrim giving a warm welcome at the ABAI virtual convention that took place earlier this year on May 19, 2020. Dr. Pilgrim's subject interests lie in young children, typically between the ages of 4 through 12 years old, but also college students and adults. Her research focus is on experimental analysis, applied behavior analysis, class formation, stimulus control, stimulus equivalence, acquisition, and symbolic function modification. Next, I will be providing a brief description of a few research articles and studies that Dr. Pilgrim has conducted. The first one is from the Journal of the Experimental Analysis of Behavior. I mentioned earlier how she was an associate editor of this journal. The article is titled Acquisition of Arbitrary Conditional Discriminations by Young Normally Developing Children. The study sought to investigate conditions that were designed to facilitate arbitrary conditional discrimination in normally developing 3 to 6-year-olds. The results of this study indicated that because there are difficulties in mastering arbitrary conditional discriminations, further analysis with young children are essential in the investigation of stimulus relations. A different study that actually doesn't follow the general pattern of most of her works is from the Journal of General Internal Medicine and is titled How Do Women Compare with Internal Medicine Residents in Breast Lump Detection? This study wanted to compare the accuracy of breast examinations administered by continuing care women versus physicians with the use of silicone breast models. The 2 dependent variable components in this study were sensitivity and specificity. Sensitivity refers to the percentage correctly detecting 18 lumps during the examination of 6 silicone breast models. Specificity refers to the percentage of examining the 6 silicone breast models without a false positive detection. Results expressed that the sensitivity measurement of women who were in continuing care remained lower than physicians, while their specificity generally remained higher. Also, the sensitivity of physicians with prior experience working with breast lumps was higher than that of physicians without that experience. I also wanted to include a few of Dr. Pilgrim's commentary articles where she discusses her perspective and takes on certain subjects and issues within the field of behavior analysis. The first article, titled Translational Behavior Analysis and Practical Benefits, is found in the journal titled The Behavior Analyst. Pilgrim comments on Thomas S. Critchfield's call for scientists to begin increasingly directing to translational approaches, and aims to discuss the importance of socially relevant research along with targeting problems by laypersons, meaning individuals who are not mainly a part of the behavior analysis community. She also talks about the importance of connecting science to practical problems. The next commentary article is from the Journal of Experimental Analysis of Behavior and is titled, Of MOs and SDs, and What Exactly is a Repertoire Anyway? Dr. Pilgrim focuses on the extent of truly defining what a motivation operation is. She also examines and sorts out the underlying concepts of what is considered to be an individual's repertoire, meaning what is a repertoire truly composed of. She explains how the interpretation of both of these concepts should be essentially parallel and understood because it could impact and influence outcomes of research studies and experiments. The last commentary article that I would like to mention is from the journal titled Behavior Analysis in Practice, with the article titled Some Thoughts on Shaping Future Behavior Analysts, A Call to Stay True to Our Roots. Dr. Carol Pilgrim discusses the importance of shaping a behavior analyst with a well-established foundational repertoire. She also stresses the importance of effective training and what it really means for those who are pursuing a career in the field of behavior analysis. She says that what is needed is repeated experience of the behavioral analytic framework. This consists of posing research questions based on literature reviews, planning and implementing experimental procedures, along with both collecting and interpreting data. She concludes her article by stating that, and I quote, shaping integration across conceptual, experimental, and applied domains must be consistently emphasized, modeled, and reinforced for future behavior analysts. We are now moving on to a few researcher mock interview questions that I would like to ask Dr. Pilgrim if I were ever presented the opportunity. Question number 1. What initially inspired you to pursue a career in the field of behavior analysis, and why are you so passionate about research? Question number 2. How much has the field of behavior analysis changed and developed from the time that you first began entering the field? And what key components do you think have contributed to such development and change? Question number 3. How did you come to take an interest in your research work at the University of North Carolina, Wilmington, pertaining to the improvements of breast examination trainings for nurses and physicians? And question number 4. What advice would you give to those who are currently pursuing a career in the field of behavior analysis? I would like to end this presentation by discussing the overall importance of Dr. Carol Pilgrim and her work that has tremendously contributed to the field of behavior analysis. Dr. Carol Pilgrim is a pillar in the behavior analysis community, being that she has served as an editor for journals and books pertaining to the subject. She has contributed her expertise through mentorship of students as a dean and professor, along with developing and implementing various behavioral research studies. She has contributed to the field of both clinical practice and behavior analysis in general through her influential research works involving stimulus control and equivalence relations, alongside acquisition development among children and adults. Her research directly relates to the work and studies that I am currently learning in my Principles and Procedures of Behavior Analysis course. We are learning about the foundation and behavior analytic framework for which Dr. Pilgrim uses to conduct her research. Thank you, Dr. Pilgrim, for all of your great contributions to this field. And I would like to give a big thank you to everyone watching and listening.